Mary was referred to the Macmillan One-to-One project for assessment and support by her clinical nurse specialist, who was worried that Mary was not turning up for hospital appointments and on her last review had an infection. They were concerned about her ability to care for herself as her clothing was dirty. Mary was diagnosed with gynecological cancer in 2010 and had radical surgery and reconstruction at that time. Her road to recovery was very difficult, and she suffered from bladder and bowel problems, pain, and had walking difficulties. She had body image concerns, and her physical relationship with her husband had ceased. Her husband left soon after. This affected Mary's mental health, and she soon began to sink into depression. She felt lonely, isolated, hopeless, and guilty, and had no interest in anything. Her grown-up children live in England, and she had lost contact with her friends. Mary's only support was a cousin. Mary had some input from the community psychiatric nurse until her depression was under control. She was discharged and has felt unsupported ever since. A year ago, Mary's cancer recurred, and she now awaits further radical surgery and reconstruction. In the year following her initial diagnosis and treatment, she was also diagnosed with heart problems. This means she requires to be reviewed and then given the all-clear by the cardiologist prior to any anaesthetic being administered. On the first visit by the Macmillan community care nurse, Mary disclosed that the past year had been extremely difficult. Her depression returned. She constantly asked the "why me" question. Her son was then diagnosed with lung cancer. Her daughter's addiction had got out of control, and her grandchildren were taken into care. Even though she knew she needed surgery as soon as possible, she put her own health at risk in case her son's health deteriorated and she needed to go to England, or if her grandchildren needed her. She did know, however, that even if a call came, she was not able to travel due to pain and discomfort. Sitting for any length of time was so uncomfortable for her. Mary had stopped caring for herself. Her house was in a terrible state, but she did not have the energy to do anything about it and did not know where to start or who to turn to for help. Her Macmillan community care nurse asked her to relay her story and invited Mary to complete a holistic needs assessment to identify all her concerns and worries. Once completed, Mary commented on the fact that her Macmillan community care nurse had listened and had not given her a row or judged her. Her Macmillan community care nurse told her that she was not there to judge, but was there to help her address any concerns, signpost to other services if required, and support her through her surgery and on her road to recovery. Mary then disclosed that things were even worse than she had first said. She was unable to go into the kitchen as it was full of decomposing rubbish and there were flies and maggots everywhere. She was unable to take the rubbish downstairs to the bin area and it was piling up in the kitchen. There was also rubbish in the bathroom and bedroom and stacks of old newspapers and waste in the sitting room. Mary was a heavy smoker, and the curtains, windows, furniture and paintwork were all yellow. The carpet was threadbare, and she was sleeping on the settee. Mary could not physically access a bath, and her personal hygiene was also a problem. Her Macmillan community care nurse contacted various departments in social services, housing and in local agencies to assist in clearing the house. A financial assessment was carried out by Macmillan Long-Term Conditions, a grant was awarded, and with a further welfare grant, the house was repainted and had new vinyl flooring fitted. This gave Mary such a boost, and her cousin commented on the fact that for the first time in many, many months, when she visited, Mary was out of pyjamas, in clothes, and had her hair done and put makeup on. The GP was contacted, and following assessment, he recommenced her antidepressants. Her analgesics were also increased to control her pain, and a repose pressure relieving cushion was requested to relieve the pain and discomfort when sitting. The Macmillan community care nurse introduced the Macmillan healthcare support worker early on, as she also worked in the cardiology department. She was able to arrange clinic appointments so she could accompany Mary and also arrange transport to ensure she attended and had the important investigations she needed to enable her surgery to go ahead. On some occasions, the Macmillan Healthcare support worker visited Mary at home and performed hand and foot massage, which Mary really enjoyed. She has also been invited along to our drop-in for coffee sessions and health and wellbeing events where she can meet others in similar circumstances and share experiences and hopefully make new friends. The team have continued to support Mary and liaise with the clinical specialist nurses locally and in Glasgow to ensure that surgery is arranged in the near future. Mary is now coping much better. Her pain is controlled and she is managing to get out a bit more with the help and support of her cousin, who is also recovering from cancer, so understands how Mary is feeling. Her son has finished treatment and is slowly recovering. With our encouragement, Mary has kept in touch with her grandchildren by writing regular letters. They so enjoy receiving cards from their gran and sending cards back. This has cheered Mary up immensely. She now lives in a clean and comfortable environment, and her self-esteem and quality of life has improved. The team will continue to support Mary through surgery and on her road to recovery until she feels able to continue with her life independently and finds her new normal.